Hi, I'm Laura Walls. I'm going to be talking to you about shared governance, which is a model for integrating nursing practice with our core values and beliefs in order to optimize the delivery of care for our patients. The purpose of shared governance is to improve the nurses' work environment, job satisfaction, and retention rates. Shared governance is also known as a nurse practice council. You may hear the two terms, they are interchangeable. The councils can range in size and vary from institution to institution. However, ideally, you start with a hospital-based council comprised of nurses from all of the various bedside units, also including nurses from PIC team, endoscopy, cath lab, OR, PACU, recovery, surgery, etc. You want to have nursing representation from everywhere in the hospital. Once the hospital-based council is organized, you then move that to a unit-based level. The representatives from the hospital council will then chair those unit-based councils and organize a group of volunteers from each of the collective units, kind of to fulfill and carry on whatever the hospital-based council is promoting and working on at that time. The foundations of shared governance started more with a human resources foundation, focusing on employees' motivation and growth. Practices such as autonomy, empowerment, involvement, and participation in decision-making were valued and encouraged. This then shifted more towards a business model, focusing on alliances within the organization, quality management initiatives, valuing a work environment, and promoting the employee's productivity, which then fosters leadership and team building. Many theories have been utilized to craft the current model of shared governance, which is based on work empowerment. Tim Porter O'Grady, who is kind of the guru of shared governance, also supports this theory of work environment and says that this creates a model where decisions are made at the point of service, aka by the nurses for the nurses. Shared governance continues to evolve with the focus now on self-management, therefore giving a high accountability to those bedside nurses in the work that they are doing. Though there is a leader for these shared governance councils, often a chair and co-chair, these folks serve in more of a coaching and mentoring role, more of a facilitator, an information resource for the group. The power is really within the council itself. There has been some anecdotal data gathered that shows that there is an improvement in team relationships and harmony, fewer conflicts, higher job satisfaction, better communication and sense of collaboration, focus on professional growth such as nurse certification, aka CCRN, that sort of thing, and a lower turnover rate. And these have been shown in organizations that have implemented shared governance. In addition to this anecdotal evidence, there was also some concrete data that was listed in the article which I reviewed. One organization saw a 1.5% reduction in the non-salary costs per patient day, an 18% fewer sick hours per FTE, and an 11% reduction in turnover. One of the other organizations reported a $6 million decrease or savings when they were able to eliminate agency nurse hours and had a higher nurse satisfaction and retention rate. I have been involved in shared governance within my organization. I was actually the inaugural chair of our shared governance, which started in April of last year. We worked on redesigning the falls policy for our facility. We collaborated to create a sepsis committee to work on sepsis within our organization, which has one of the highest mortality rates within hospitals at this present moment. We created a Greatest Catch Award, which highlights the importance of incident reports, rather not near miss reports, and that they are meant to be opportunities for improvement and not punitive. Those are just some of the things that I have been involved with personally within shared governance, and we've seen the council grow from about 15 members to 30 now, and we have implemented unit-based councils at this point. Shared governance can be extremely mutually beneficial for both nurses and the organization within that they work. There is improved job satisfaction for sure, higher retention, which ultimately results in better care because you have tenured nurses caring for these patients at the bedside. And along with that comes a lower financial burden for the organization when we are better stewards for the equipment, the supplies, and the care that we provide. It is important to remember that shared governance requires a commitment not only from leadership but also the nurses, understanding that there is high accountability for the care that we provide and the decisions that we're going to make. And leadership must understand that they have to turn over the reins a little bit and let these nurses that work at the bedside make these decisions based on the evidence that is out there that supports these clinical interventions. Through implementing shared governance, a collective voice of nursing can be created, which improves the perception of the profession as well as theory, science, and practice. Thanks for listening.